Green, is it?
Good morning, everybody. Hello and welcome to today's COVID-19 Recovery Network panel event. My name is Claire Fleming and I'm the Director of Marketing and Communications at IIRSM. Your host today is IIRSM Fellow Hugh Maxwell. We'll get started in a moment, but before I hand over to Hugh, there are a few things to run through. To begin with, you should see to the right of your screen a toolbar with various options. As the microphone shows, you'll be on mute for the duration of the webinar. Please feel free to ask any questions or make any comments using the chat function and the panel will do their best to respond. Any that we don't have time to answer today, we'll add to a Q&A document and upload to the website once the third event has taken place in October. If you need any support using GoToWebinar, the I symbol will take you to the support site. Finally, this webinar is being recorded and a copy of the recording will be placed on the IIRSM YouTube channel after the event, where you'll also find a whole range of free-to-view webinars on various risk topics. Enjoy the session, and I'm now going to hand over to Hugh.
Thanks, Claire. Thanks, Holly and Susan and the IIRSM for this opportunity to chair the second webinar focusing on COVID recovery-related topics. I'm joined by an esteemed panel today, and the range of questions we'll be concerned with today will cover a scope of topics including mental health, well-being, cybersecurity and human factors. So please feel free to contribute. My name is Hugh Maxwell. I've been associated with the IIRSM for over 20 years, a fellow since 2008. And I'm quite passionate, as you probably are, that we all learn and share from each other as much as we can moving forward to make our workplaces much safer and lower the level of risk. Without further ado, I'd like to hand you a round robin to our esteemed panel. If I can ask you each to introduce yourselves, starting with Andy, please.
Yeah, good morning, everybody. My name's Andy Neal. I lead the Security and Safety Division of Cardenas Risk Management. Been involved in safety for over 20 years after a military career. And I advise on people and asset risk, particularly with travel risk and monitoring personnel across the globe.
Thanks, Andy. And Carla, please.
Hi all, I'm Carla Gunn. I am a senior consultant in the risk advisory and analytics team at Barnett Waddingham. I've been there just a little while and I'm very much enjoying it. I think I'm here today partly because I'm sitting here in Australia and we're going to be talking about people working remotely. So I think you can't get much more remote than that. I am very involved in business continuity, crisis management and risk management.
That's great, Carla. I think we're going to be hard pushed to get anybody from further afield to join us next time. Thank you so much. Yeah. Helen?
Good morning, everybody. My name's Helen Barge. I'm also a fellow of the IIRSM. I run a management consultancy company called Risk Evolves, and we focus an awful lot on data risk, so cybersecurity, information security, and we love everything about the GDPR. It's a slightly different angle on risk this morning.
Tremendous. Thank you so much for your input. We're looking forward to that. And Sam?
Hi, my name's Sam Kendall. I'm Group Health, Safety and Compliance Manager for Valorum Care Group PLC, specialising in healthcare and complex needs of people and understanding well-being. So I'm here to support you in that region today.
Looking forward to your input as well there. And last but not least, fellow Scott. Scott.
Morning, everyone. Scott Moffitt. I'm Human Factors Director at People Factor Consultants, or PFC. My expertise is in the 6 non-technical skills, which is stress management, communication, situation awareness, decision making, teamwork and leadership. I do a wide range of training, observation in simulators and any associated methods when we're looking into individual and small groups, behaviour and also systems. Thank you.
Thank you, everybody. So as you can see, we've got a very diverse set of panelists, a lot of expertise in their own fields, and a lot of good experience of recent. What I'd like to do, based on the first webinar we had, it's quite obvious that people are feeling very strong, very emotive, and we thought it'd be a nice idea to start with an opening poll. So we're going to run a couple of polls through the questions to break things up and to get you to interact. Claire, could I hand over to you with the first poll, please? So the first poll we're going to run, really, I'd like to ask you all, as individuals, do you feel that the pandemic lockdown has affected your own mental well-being? Could you select one of the three options, please? Yes, somewhat, yes, considerably, or no, not in a significant way. We'd like to give you 5 to 10 seconds to vote now, please, then we'll share the results.
Just give a few more minutes, Hugh. We've only got 28% of the vote at the moment. That they're coming through quickly.
Please don't be shy.
Almost there.
Lovely.
Okay, I'll close that now.
Thanks, Claire. Will we share those results now, Claire? Oh, wow. That's good real-time voting there. So, as you can see on your screens there, half of us feel that the pandemic lockdown has certainly, to some degree, affected our mental well-being. That's an awful lot, considering that we're meant to be the risk and safety managers. If it's impacting on us, some of us who've had a high level of training in these areas and in dealing with some of these issues, some of us may have not. That's a hell of a lot, 52% of our poll panel. Nice to see that 37% feel that it's not been affected at all. But I think there's still a lot to be learned there, that, you know, 2/3 of who we're talking to have felt some impact. So hopefully we'll get some benefit from this forum today. So please, there is the opportunity to ask questions, which you can do, as Claire mentioned earlier. But what we've actually done beforehand, we've prepared some questions with the panelists based on some of what we see as hot topics. So the first question I'd like to share is actually one relating to behaviour and culture. Should we expect people to be functioning at their optimum level of performance at the current time? And what factors affecting behaviour or culture post this lockdown should we be most concerned about? Could I ask first Scott to give us his views on this one, please?
Perfect. Yep, thank you. So the first part of the question is, should we expect people to be functioning at their optimum performance upon returning? And the quick and short answer is no. Unfortunately, the amount of stress and pressure that people are under at the moment, whether they've been furloughed or whether they've been continuing to work through. Now, some people have been sitting at home with the stress and the pressure of being furloughed. Other people have been going 110% right the way throughout. And what people don't realise is stress that can affect us both when we're not being pushed to the absolute maximum and when we're going 110% all day, every single day. So people now will be feeling the effects of stress at home or whether we're working continuously through. And the effect that has on the 6 non-technical skills I mentioned earlier is you can further break these down into the cognitive skills, which is situation awareness and decision making, social skills, teamwork, leadership and communication, and the personal resource management skills, which is stress management. Now, if you look at the cognitive skills basically situation awareness and decision making, how we can take in information and how we process that. Our brains are hugely affected by the amount of stress in which we're under. Sitting here listening to me, and in my Invernessian monotone accent, there's nothing that's going to really stress you out or annoy you. Whereas when we're at work or sitting at home on furlough, we can be under a lot of stress and pressure. Therefore, if somebody's been sitting at home for 2 months, 3 months on furlough, under a lot of stress, under a lot of pressure, we're then expecting them to return to work. Basically, their brain is not going to do what it's programmed to do. The amount of information that will be taken on board, the amount that they'll be processing will be dramatically reduced to what it was before we went on furlough. Basically, the two main parts to your memory, you've got the working memory and the long-term memory. Working memory takes in information and it sends it through into long-term memory. Long-term memory stores everything. We can remember things from 3, 4, 5 years of age. We take in information, we process it, and it remains in the long-term memory. These two things must speak to each other. The working memory and the long-term memory must speak to each other. The more stress and pressure you're under, it just basically sticks a barrier between the working and the long-term memory, which means we cannot take in and process information. So if people are coming back from, say, 3, 4 months of furlough or longer, the brain is not used to seeing everyday things like it is when they were at work. So what will happen is their brain will start taking information from 3, 4 months ago and it will start using that. It's called confirmation bias, but it's seeing what we expect to see. So instead of the brain taking in information and processing what it's seeing, it will take in information and process what it was maybe seen and it was used to 3-4 months ago. It's so yeah, and the short answer is no, people can't come back after this, and we can't expect them to be functioning at their optimum performance. Because stress, there's been people going 110 miles an hour, and there's been people who have been furloughed from home. An example that I was using the other day actually is the first time I got in the car during lockdown, I just went straight through a red light. I didn't mean to. It's because my brain's just not processing information the way it was. So things that were nice and easy before lockdown, or bread and butter as well, is not so easy, so can become very difficult and can lead, unfortunately, to incidents and accidents, especially with human error.
Scott, thanks for that really comprehensive answer. I tell you what, real food for thought there. Because I mean, if we, if you as a specialist are flagging these things, a lot of businesses aren't this aware. Andy, from your perspective, can you put a bit more, any further inputs there that from your viewpoints?
Yeah, thank you, Hugh. I think what Scott was talking about was very intrinsic to coming back to the workplace. I think from my perspective, it's about people would assess situations and go into situations based on their own experiences. And obviously COVID's hit us, and it's a very different working environment now. So purely from my side of things, everybody would assess risk differently from how their experiences with COVID, their lifestyles, their family experiences, their community experiences. When they travel back into the workspace, then there may be added pressure within their environment. So we would always condone working to systems. So if, as health and safety practitioners, give the workforce systems to work under so that they can risk assess in a methodical way to combat and mitigate risks with COVID. So it's kind of exactly what Scott's talking about, but easing that pressure of coming back to work with methods that support the working environment. That's the only thing I would add to it.
That's great. And I think that really does, when none of us in the past, we've relied upon good systems and processes in the business. It's really important for these organisations to make sure they adjust and adapt and build these new robust systems. Helen, coming from the sort of monitoring software side of things, how does this impact, and how do you see this as an issue?
Just picking up on a point that Scott made actually around people looking to see what they're expecting to see, and sometimes the brain not processing exactly what is there. One of the things that's occurred since lockdown back in March is, and these are figures from IBM, we've seen a 14,000% increase in phishing emails, which is just a phenomenal increase. The cyber criminals, or other criminals, are taking their business online. And if you have got a person that's not looking very closely for what those clues are, that it is a phishing email, so coming from the wrong address, is the language incorrect, and you're looking to see what you're expecting to see and actually not seeing what you should be seeing, then clearly that's a huge risk to business. And I think, Hugh, one of the things we were talking about as part of the prep to this is we've started to see organisations begin to introduce monitoring software to understand how often people are logging onto their machines, what applications they're using, etc., etc. They've got some great business benefits, absolutely. You can absolutely look for productivity improvements. But one of the things that we're just highlighting to companies, they also come with a little bit of a health warning as well, because if you can monitor what your employees are doing and you're noticing that they're working at 11 o'clock at night, then clearly you have a duty of care to those individuals as well. So I think there's a huge amount of pressure on staff at the moment, whether you're an employee, whether you're a contractor, and as employers and as health and safety experts, we just need to be very cognizant of what's happening in their lives.
Thank you, everybody. I think that really does put things, in different perspectives from different environments. It really does make you think about the true effects and impact on mental welfare. And this leads us on to our next poll question, which I think, ties in nicely. So what I'd like to ask our audience is, do you think that performance of your workforce has been affected by remote working? It'd be nice to see what you think, how it's impacted on your actual business itself. The options being yes, significantly, yes, but only slightly, or no, not at all. So please share with us your views on this one.
Just 12% have voted at the moment, so keep them coming in.
This is confidential, our friends. It's between us all. Anything that's said on here as well is our viewpoints, and it's it's a very open panel. There's nothing's going to be fed back to anybody.
We're almost there. Okay, I'll display the results now.
So it shows us there, so 86% saying yes, either significantly or only slightly. There's definitely been an effect on the workforce by remote working. And I think it's been I think, you know, if you look at it, it's been a massive adjustment, even for somebody like myself who's used to working at home regularly, because I've been doing it more frequently. I must admit, I felt under a lot more strain and pressure. I felt much more obliged to try and get the job done, even if it means getting it done out of hours. I think one of the biggest problems I've had is actually differentiating what was the significant few things from the insignificant many, and sometimes prioritising has been a problem. So this leads us on to another good question regarding human factors. What human factor intervention techniques can we employ to reduce risks in this area? Scott, again, I'd be interested in your view on this one to start with, please.
No problem at all. So a lot of the things that we look at as well is the system and how the system actually operates. And one of the things that we do is we look into procedures to make sure that they actually do what they should be doing. So one of the things straight off upon returning, or people still within the workforce, is to look at your procedures. Your procedures, especially within whether it's emergency procedures or everyday procedures, what you're trying to do with a procedure is just slow down the decision-making process. So one thing you need to make sure is that your procedures are up to date and people know and understand the procedures. If your procedures aren't up to date and something starts going wrong and they can't follow it, it can quite easily, like we say, procedures are there to slow down the decision-making process. You don't want your brain to go off on a tangent. The procedure's there to try and keep them in a strict line. The procedures aren't correct, then they could quite easily go off on a tangent and down a garden path that they don't want to be in. So that's just simple. Another simple one actually is one that I've started using all the time is checklists. Because we've got so much information available to us at any one time, I just write down 4 or 5 things at the morning, what I need to accomplish, and then at lunchtime I'll write down another 4 or 5 things. It's just so my brain's got something to focus on, and we can take that into everyday life, whether it's high hazard industries or everyday life. If you've got a small checklist with you, it can keep your brain focused and stop you going down that garden path. And just small benefits as well, and little techniques for simple things like communication. Keep your communication short, sharp and concise. If you're on the phone or the radio or the email and you're giving over screeds of information, the brain physically cannot take in and process that amount of information. So if you keep it short, sharp and concise, the brain can take it in and process, which will lead hopefully to a better understanding. Also keep the communication two-way. Don't just say, yes, okay, I hear that. If you say 1400 PSI, don't just say, I hear you, copy that. Ensure that the person repeats the information back to you. That way you can actually physically check if the brain is taking in and process the information. And just something as simple as how you ask certain questions. We're all interested in checking, understanding and checking people that are listening, but what you don't rush through it and what you don't ask closed questions like, are you happy? Do you understand? Do we all know what we're doing? That'll be met with a nice chorus of yes. What you want to do is you want to check that the brain is taking in the information and processing it. So if you ask questions, what are you doing? How are you doing it? Why are you doing it? The brain has to take in the information, it has to process it, and you can tell if the person is listening and actually understanding. So there's just nice, easy ways, whether it's small groups and individuals with the communication, or when you're looking at the larger way with the procedures.
Thanks, Scott. That's very useful. Andy, I believe you've got some inputs here that might be worth use as well, yes?
Well, in reference to procedures and how people operate, and what we looked at is giving a common ground on how people think. So on the commute into working experience, how they risk assess those sort of areas. So if you go along a bus and you speak to everybody on a bus or a train or a tube train or whatever, how they risk assess a COVID environment on there. So again, talking about what Scott's, we actually gave them a method of how to actually risk assess a COVID environment using a mnemonic that we came up with, which is called SOAP. Basically, what surfaces are they touching and how long the virus lasts on those surfaces, what objects they may be touching, cups, pens, whatever. And what the area is like. Is an area COVID away? We've already started to see lockdown in certain areas, but the business is still running because the government or the local authorities are saying that the the business sector has good COVID awareness, and that's to do with markings on the floor. We've all been through shopping centres, so it's assessing the areas for COVID environment and then assessing the people's conditioning and how they're operating for social distancing, what PPE or respiratory protective equipment they're wearing, and giving people a tangible system to actually work to risk assess within their commute towards the office environment. So that's how we're doing that. I'm actually doing that today as we're speaking.
Thanks for that. I can ask the panel, I mean, that brings you on to a good point you mentioned there about PPE and the use of PPE. I think you see a lot of people who are intentionally ignoring the use of PPE or social distancing. Anybody got any views there, and how best to approach that? Any volunteers? Sam, don't stay, put the boot in. Yeah.
No. I think the first thing is knowledge and understanding, because do people know how to put it on, take it off, take care of it, why it's important? And I think once you can embed that knowledge and understanding on how to keep yourself safe, what it's used for, and why it is important and what the consequences are of not wearing the PPE, then I think you have a better expectation of people following guidance and being compliant. And so as well, people are opting out of wearing PPE because people have said, oh, you've got these medical conditions, you've got this, you've got that. Has anybody looked with these people at suitable alternatives, ways of keeping them safe, how to mitigate risks in another way? And so I think there's an awful lot still with PPE around educating people.
Thanks for that, that's excellent. I think always cooperation rather than coercion is key. And as you said, explain to people the benefits rather than feeling they're imposing it. This comes back to the good point raised earlier by Helen about the importance of IT and IT management. Could be, again, a good point for a poll. Have you or any one of us in the audience, in your organisations, seen an updating in your data and IT protection policies since lockdown? Here's the question. Yep. Have you or anyone in your organisation updated your data IT policies since lockdown? Yes, no, or you're unaware? Because a lot more of us are working from home, so obviously the risks, things like phishing, the risks of people getting hold of sensitive data is much, much greater. We'd like to know what your views are on that one.
Almost there.
Okay.
About half of you have voted so far. I'll give you a few more moments.
So quite surprisingly, 37%, 4 in 10, 2 in 5 are saying that there has been an update in the IT policy, which, I mean, that leaves us about the same number who are actually saying no, with a quarter of us saying that they don't know. At this time where we're so reliant on data, now those numbers are quite a concern, really. I mean, these things might be happening, but I think more important than ever now, personal data, whether it's GDPR, as well as business confidentiality. It's very important that we try and ensure that we have the right controls in place, which brings us on to a really good question again for Helen. On the issue of data security, what would you say are the key or priority security issues that companies or we as individuals should really be considering?
Working at home and remote working is presenting a whole series of different challenges. If you've got laptops at home, you need to make sure that the environment in which the individual's working is safe and secure. This is around their network access, but also some of the more peripheral stuff that perhaps we wouldn't necessarily think about. So are you potentially sharing your work machine with somebody else in your household? And again, Scott and I had a conversation yesterday about workplace distractions. You may have children around you, which clearly in the workplace you may not have had before. You probably haven't had before. Are they interrupting you? Are they distracting you? Are you allowing them to play games perhaps on your laptop, which could be introducing some viruses and malicious code onto your machine? but also consider whether people are printing at home as well. So if are they printing something, perhaps they're printing a payroll file, for example, what's happening to that piece of paper? In the workplace, they'll put it into a confidential bin for shredding purposes. Where's it going in the home environment? And there's lots of other considerations around data security. So, you know, what are people clicking on? What access to data have they got? Who else is in the household that may be overhearing conversations? And it's just a really great opportunity to remind people about what your information security policy is and what your data privacy policy is as well.
Thanks for that, Helen. Again, that leads us really on to the next question, which is my company's data more at risk at the moment with remote working? And if so, what actions can you take to prevent it? You've fed us with some of these things, but any other things that we should be, you know, we as individuals should take responsibility for doing, you know, in terms of good working practices, in terms of, I don't know, things like locking computers, laptops away, things like this?
Yes, I had a really great case actually a couple of weeks ago where somebody was saying that because she got into discipline in the office of always locking her laptop whenever she left her desk, she was really, really glad that she did, because her cat walked over the keyboard while she was working in her kitchen, and she said goodness knows what that cat could have accidentally sent or damaged or whatever, whether she'd been working on a spreadsheet. So she felt that the hygiene, if you like, the repeat process of continually locking her screen in the work really was useful at home. What else do we need to consider? I think we need to consider, and I know we were talking about this as well with Sam, was around the type of data that you may be collecting that perhaps you haven't collected before. So we're talking about, you know, if you're doing temperature testing of staff, where are you keeping that information? How long are you keeping it for? Are you collecting any information on whether individuals in the household have been either tested or have tested positive for the virus? And you just need to think about how long you're keeping data for, where it's being kept, who else it's being shared with, how you're going to destroy it, and so on. Just the good hygiene factors that we would have under the Data Protection Act.
So in terms of length of time for keeping this high healthcare declarations, what's recommended or what's seen to be the norm?
It depends what you're collecting it for. So, for example, in the office, we just have a register of who's coming into the office and who's going to go out. And we're keeping that information for 21 days. And that's in the event that one of us is tested as positive. I know within that 14-day window who else is likely to have come into contact with that individual. But there's other pieces of data that you need to keep. I have to say the Information Commissioner has put a huge amount of information and guidance on the website. And if you're unclear, then either talk to your data officer in-house, or potentially you've got a data protection officer, talk to your DPO, look at the Information Commissioner's office, or I have to say we'll always help individuals if they've got queries and questions.
Fantastic. That's going to be useful to a lot of people out there, I think, Helen. Thank you so much. So guys, this leads us really on to the next question, which is really how we as individuals can innovate and plan for the future when we're actually working remotely and independent, we're actually interacting with our teammates. Carla, can I ask your views on this one, please?
Well, I think this is a really exciting question, because I think it's essential that we are still innovating and collaborating and working together. I was really inspired by, for those of you who attended the IIRSM conference on Friday, Nigel Girling was talking about permission to do things differently, and it's really an exciting time because things are never going to be the same. So we can actually take that permission and try and break things and do things differently. And while, you know, speaking to Scott's point, that might be a little bit hard from a cognitive load perspective, it's a really great opportunity. And I am very lucky. I belong to a team where we believe in doing things and asking for forgiveness later in terms of innovation and creativity. So I think this is a time where we are open to trying new things, because we're not in the same patterns as we have been before. Speaking to Scott's point, of course, we have to talk to one another, and that two-way communication is absolutely essential. And I can speak to this because I am sitting here in Australia and the rest of my team is sitting in the UK. And not only are we physically distanced, but we have time differences as well. So we have to make time for one another. But it doesn't mean that we can't be innovative and creative and find solutions to things. You know, we might need to think about the way we create teams and the way we work together. it's actually a really exciting time. I don't know what the rest of the panel thinks, but I'm actually quite energized by the possibilities that we have in front of us.
Any other views there? Anybody? Any comments? Do we see this as a time for opportunity, a time to innovate? Can we go for that?
Absolutely, I completely agree with everything that Carla has said. You know, we have seen over the last 6 months now huge strides in automation, in innovation, and what is it? Necessity is the mother of all invention, I think is the phrase, isn't it? I think any business that thinks they can go back to where they were before, back on say the 1st of March, is missing a huge opportunity. And I really think that we've got a great way looking forward with a blend of remote working and office working to really change how people are working in the workplace.
And I think that's a really good. Sorry, Sam, please.
You know, I just wanted to just sort of expand that a little bit into technology. You know, making sure that if you are using Teams or Zoom or Skype or any other platform, that you actually teach the staff how to use it, because it creates anxiety in itself when people are just given a system and they're not actually given training on it. There's lots of other ways we can use technology in terms of contactless payments, accounting, resource management, and maybe this is something for another day, 3D printing, online keep fit, 5G, phone apps, wellness apps. You know, and that sort of leads on to surveillance, which I know, Helen, you're very big on in terms of how we monitor our staff. Don't know if you wanted to mention any rules around surveillance monitoring of staff. Muted.
There we go. There's the classic webinar fault, isn't it? Put yourself on mute. On surveillance software, this is all around doing the risk assessment, making sure that you understand exactly what you are going to be surveilling, why you're going to be surveilling, what you're going to use the information for, what you're not going to be using information for. So if your intent is to start doing surveillance monitoring for productivity improvements, you can't then use it for disciplinary, for example. So being very, very transparent and making sure that staff and employees are all aware of what you're doing, why you're doing it, and how they can access information if required. For me, transparency is absolutely key in introducing any sort of surveillance type software into the workplace. But that's not to say don't do it. To Carla's point, you know, we've got great opportunity to innovate. Just be mindful that you need to take various controls to make sure it's done properly.
Lovely, that's excellent. Which leads us on to, we've talked a lot really about technology, about the importance of how things are now, but there's a longevity to this. And what I'd like really is, the next question we've got is, what's the long-term psychological effect of this working different patterns we were all seeing? What's it likely to be, and how can we best prepare? And if we are working with people who are going to be prone to some form of post-traumatic stress disorder as a result of these experiences during this pandemic, how should we be looking to try and recognise and deal with this? Sam, I believe this is one close to your heart, yes?
It is, yeah, and I'm going to take about 6 minutes to cover it, if that's okay. I think the first thing to do is start right back at the beginning and look at different psychological phases of the pandemic. So the first phase was obviously the anticipatory phase, where people were planning and doing preparation. They could see it coming. There was the anxiety of the unknown. And then people moved into the active phase, which was the, you know, heroics and camaraderie and surging to find solutions, and then potentially overstepping boundaries, overstepping, you know, the hours that they worked, and becoming disillusioned, exhausted, particularly looking at moral distress around ethics and changes in, you know, how we manage patients, for instance, compassion fatigue and stress, and that could lead on to, you know, serious health problems. And then the recovery phase of it is around, some people come out of it very well, and they built up quite a lot of resistance, you know, and had some traumatic growth. Others have not done so well. They are struggling with, you know, the idea of being a hero because they didn't save everybody. So there's some guilt there. They're tending to hide their problems because they've been labelled as a hero. They found difficulty in keeping contact with family, and, you know, this is still ongoing. And so that can lead to the PTSD and the burnout. And if you look at statistics, and we did the polls at the start, you know, when you think about the health burden, mental health is a quarter of the health burden that we have, and 8.1% in the IFS study have said that they actually felt that their mental health has worsened, and 63% are actually still worried about the future. And so we have to look at the stages of when people are becoming unwell. And I know Scott and what have you talked about behaviours, but, you know, first of all, we've got people who are healthy, positive outlook on life. Then they move into like just coping, where they have odd days where they're struggling. Then they move into a greater level of struggle, where longer periods of negative thoughts and emotions, and then becoming mentally unwell. And so any resources that we put in place has to be phased about like a bit like our hierarchy of controls. You know, we start off with managing basic needs and physical resources, moving into balanced factual information and support for the staff, then looking at moving up to mental health, first aid and platforms for the staff, so they've got something, some confidential signposting, and then maybe even up to psychological intervention. And, you know, when we look at people who are particularly at risk of breakdown, you're looking at people who are in the high risk groups. If you're imagining that you've been told over and over and over again that you're clinically extremely vulnerable or vulnerable, then your level of anxiety and hypervigilance is going to be much higher than somebody who feels they're young, fit, healthy, and it's not going to affect them. People who are on low incomes, in low quality work, poor housing, people who are social isolated, and that includes, you know, women and young people as well, because remember, people are at university, at college, in apprenticeships, etc. And I know that Scott and Andy and what have you focused on stress. You know, whilst we've covered a lot of return to work, there are a lot of people who have been working 12-hour shifts in respirators and all the rest of it, and we need to think about those people. You know, the demand that's been put on them, the increased hours, loss of control over, you know, their working environment because it was what was coming in on the day that they had to cope with, and their fear of actually catching the illness or giving it to loved ones. Remember, some of the care staff stepped outside of their family dynamic to keep their family safe, so they were even more isolated from their children. People who've worked at home, you know, like me, some of my work is at home, some of it's out in the field if I'm fit testing or whatever. And so lack of exercise, weight gain, increasing your own personal comorbidities, lack of leadership is one of the big risks. We've talked around communication, but if you're sat at home a lot and your boss is in back-to-back Teams meetings, you know, and you haven't got that support network. So it's making sure that there are times in people's diaries when they can connect with people, and like Scott said, about asking the right questions. Money insecurities, you know, where there's companies making redundancies. Is it going to be me next? Am I going to be able to pay my rent, afford my house? People are not able to switch off as much. And also we need to think about the people who are in situations where there's increased violence, you know, and if you think about in the first 3 weeks of the pandemic in the UK, 16 people died and 2 of those were children, you know, and Refuge has seen a 49% increase in the need for support. And all of this can have an effect on work as well. So again, my colleagues have talked about poor productivity, errors in judgment, unsafe conditions. When you're tired, you will get angry, you don't think straight. People, there's been a massive increase in substance abuse, alcohol abuse, there's been suicides of staff. And also when you've got somebody who has, you know, become quite demoralized at work, what you've got to think about is how you manage that in a safe way, because there is the impact on others. And so it's very easy for somebody to bring down another person's level of positivity. you know, and
Yes.
that can have an impact on the whole team. I think in terms of actions, horizon scanning, I've been in UK scanning the rolling 7-day average, the hospital admissions and all the rest of it. From about the 4th of August, I started to note a daily increase, and I could see that that was becoming much greater. So I knew that community transmission was increasing. And so factoring that, the need for additional recruitment, additional training, additional support mechanisms, additional PPE, additional IT infrastructure. So that horizon scanning is really, really important so we don't leave people out in the cold. I think adapting routines and activities, making sure people at home get breaks. You know, there's back-to-back Teams meetings and all the rest of it. Make sure they get the breaks, make sure they've got the right equipment and your expectations of them are appropriate, because we all have Mr. Reliable. You know, the one person we know will do the job no matter what. And unfortunately, what happens is Mr. Reliable gets every job that nobody else wants to do and becomes overburdened. But they're your key people. And so if you overburden them and you lose a really valuable resource, and you know, that has a massive impact on your business. Diet and exercise, we've sort of said, give your staff some advice on, you know, self-care. You know, I think with us, we've got mobile apps and all sorts of stuff on our phones. We can say whether we're having a good day or not. You know, advice on money and budgeting, where they can go for that. Making sure that people have the proper support mechanisms in place within the company and signposting them to places outside of the company, and just actually monitoring. And I think, you know, what Scott said around asking the right questions is really, really important. We have like monitoring forms, but then I'm going to revisit them, Scott, now, so thank you for that, to make sure that they're all okay. In terms of traumatic stress or PTSD, that's at the much higher end of the spectrum, you know, and you know, these people are emotionally shattered and they will take a very long time to recover, and you cannot expect somebody who's gone through that to just pick themselves up. You know, people talk about man up strategies and all the rest of it. No, it doesn't work. You know, what we have to do is work slowly with these people. They might have racing thoughts, palpitations, guilt, resentment, you know, about people who are out there not wearing a mask and they've been in a respirator for 12 hours a day, 6 days a week or whatever. They've got a feeling of helplessness, sometimes hopelessness as well, and they're usually not sleeping very well, and the more you don't sleep, the worse it gets, because you can't concentrate. So the people who are most at risk of the PTSD are the people who've recovered from serious illness. Those have been through the worst, you know, the ITU people, the people who've been on, you know, CPAP machines and all the rest of it, the people who've lost families, friends, work colleagues, particularly if it was in a work environment within which you work, you know, and you've seen, you know, we've lost doctors and nurses and what have you in hospitals, you know, and so that has an impact on the rest of the team as well, because they're worrying, am I doing everything right? They got it, how I could possibly get it. You know, people have seen things beyond human comprehension and understanding, you know, and what you've got to see is in some countries where, you know, their sort of healthcare infrastructure is not as good, people being turned away because they just couldn't afford the care or get the care, you know, and it's hard for one human being to envisage that for another human being, you know, and so people, you know, have had intense situations and will have intense reactions. So, you know, we need to help them to avoid reliving it, to help them to put off major life decisions, or, you know, in terms of internal promotions as well, let them cope with what they can cope with slowly. And do the one day at a time thing, help them to challenge their sense of hopelessness, you know, and you know, give them time off for professional input, because they are going to need to attend, you know, counselling and all the rest of it. And so for bosses, I would say, you know, expectations need to be realistic to prevent burnout, ensure your staff have a good work-life balance, and assert boundaries with them. You know, not everybody can be a hero. Have the well-being conversations and make sure there's visible leadership. Look at things like mindfulness training so they can understand their thoughts and feelings, help them to build resilience with coping strategies, support networks, and there's lots of resilience training out there. Helping to manage anxieties of high risk groups and those of return. So your return to work strategy, you know, your risk assessments, how you're going to manage that. Remember, if somebody as well has been shielding for quite a long time, then they might have lost the skills. So something as simple as being able to put on their PPE and protect themselves, they might need completely retraining. They might need extra protection. So around that competency and that return to work, don't forget the support when people come back after they've been unwell or they've been off on furlough or shielding, etc. And so that's me really, just sort of rushing through it. But there's a minefield. There's a huge amount of resource out there if you want to look for it. You know, there's societies of psychologists who've put stuff out. There's Skills for Care. There's all sorts of people who are offering Mind. You know, so please, if you think you've got any concerns, remember your first aid needs risk assessment. Remember mental health might form part of your first aid needs risk assessment, and make sure you've got appropriate resources in place.
Lovely, excellent. That's well covered. And I think it really does raise the importance of not just managing for today, but looking forward and looking beyond. And as you said, this return to work process is so important if we are going to make people feel valuable and not feel vulnerable in the medium and long-term future. Thanks a lot for that, Sam. Right, the next question I've got, really, we're going to really throw back to our friend Carla. What skills should we be developing to help us manage any such future crises? Carla, would you like to kick off with that one? Then we'll ask the rest of the team for their inputs.
Absolutely. Well, it sounds like there's a lot we have to deal with at the moment, and I'll leave the personal skills to one side because I think the people on the panel are probably more qualified than I am to speak about that. But, you know, personally, we all have to take responsibility as well for the skills we need to get us back. You know, personally, a tip from me is I know I think the worst. My reflexive action kicks in and I have to stop and change my thoughts really between that first initial thought and take a breath and change my thoughts as I go forward. So as a crisis manager, that's one of my key skills. And we do have the ability to change our thoughts and our actions as we go along. So the skills I think that we are going to need, particularly from a crisis management or a business continuity perspective, a professional perspective, if you like, is we will need to be thinking about planning. Just because there's a crisis going on doesn't mean that other crises are not happening at the same time. Things are still happening, things are still going, and we need to be prepared for them. And I'm seeing two very divergent schools of thought at the moment in my work. I am seeing people who are just saying it's all too much. We can't think about anything else that's going to happen. Those people I fear for a little bit because they're not taking on board the lessons that we are learning at the moment. I understand completely why they're doing it. On the other hand, I'm seeing people who are saying this is absolutely the time that we have to become more resilient and we have to think about the way our workplace is changing, how we evolve our policies, our processes, how we are going to move into the future, because we are never going back. And I really liked the last COVID webinar where we were talking about not returning to work. It's returning to a traditional workplace perhaps, but the way we work was probably always going to be evolving and changing, and it would have been anyway. It's just a little bit more radical. So I think, as Sam said, you know, the resilience skills, we have to build them. We have to take responsibility for ourselves. We can't rely on our workplaces to do all of that for us. But it would be great if the workplaces could do that with us. It's important that we have conversations. It's important that we develop those two-way conversations with our employers and employees and work out how things are changing, how we can make sure everyone's accounted for. So in resilience planning and business continuity, crisis management plans, what happened during this incident? What can we do better? How can we improve our processes, our policies, all of those kinds of things? But that has to be a two-way dialogue. So people have to feel empowered and included and able to speak up and share their thoughts and feelings. And the organisation has to take that on board as well. So it does have to be two-way. And as Sam was just saying, people are feeling really fractious at the moment. I feel that there's a little tipping point, if you like. We are in sort of compassion fatigue, but I think we have to remember to be kind to one another and listen to each other. That's a lot of talking. I'm really keen to hear everyone else's thoughts as well. I'm sure there's more.
Sorry, Andy, can I lead over to you on this one? Have you got anything to add in there, my friend?
Yeah, thank you. I think I'm going to go back to what Scott and Helen said. Firstly, what Helen was talking about is educating the workforce to work on a different perspective. I mean, knowledge is power. We all know that as health and safety professionals. So we always put the message out that nothing has changed. Just like Carla's saying, there's all the other sort of resilient programs that we need in place. This is just adding another layer to the process, and the layers working with COVID, because I think we've all described that it's potentially going to be around for a long time. So therefore we have to work within those parameters. And to talk again, to shift to what Scott was talking about, good communication process and teamwork, and everybody working together. And one thing I will say, and we're certainly working with it now, is almost a 360 loop back to a management team or a safety team. All these measures in place, we can do as many preventative measures as we can, but if it's not operationally working within the workforce, give everybody the voice to be able to go back to the senior management or the safety management and advise them that it's not working within their particular field of work. I think it's key. So with Scott and Helen, knowledge and teamwork communication is key to getting these processes working on a layered approach to something that's going to be with us for a while. That's just my take on it.
Thanks, Andy. Helen, your inputs there, please.
I agree with everything that Andy's just said, and I would also say expand it a little bit beyond our own borders. So if your organisation is changing, you can pretty much guarantee that your suppliers' organisations are changing, and probably your client organisations are changing as well. So just be very mindful of how you may need to adapt to meet your client changes and requirements, and also you may need to work with your suppliers to make sure that they can meet any changes that you've got in your environment as well. So look both, if you like, up the supply chain and back down the supply chain as well, to understand what changes outside of your scope of control may actually influence your business as well.
Thanks for that, Helen. Sam, you got any views there?
Yeah, I just think sort of stepping away from COVID as well. Whilst COVID can have a massive impact on your business, you also need to look at all the other crises that could happen whilst COVID is going on. And so, you know, have you still got enough fire wardens within your building, first aiders within your building? Are your you know, your plans to deal with emergencies still effective? You know, are parts of your building shut down? You know, how are you managing safety whilst parts of it are shut down? And look at things like, you know, your Legionella and all the rest of it. So let's not take our eye off the ball from the other really, really important things where we could have problems, you know, with COVID, making sure that, you know, all essential services are still maintained in a safe way.
Thanks for that. It's really important, Sam. And coming back to where we started, Scott, can I ask you for your input on this one, please?
Yeah, I'll keep it short and simple. Don't assume that people understand these skills that we've been talking about. A lot of people think, communication's easy. I've been talking since I was 3 or 4 years of age. There's a lot more to communication than just talking. One, it's been mentioned 100 times, is the ability to actually listen and understand people. People think stress, I don't get stress. Well, every single human being on the planet gets stressed. It's the effect that it has on our situation awareness, how we take in information, how we process that. If these are not where they quite should be, and you've got employees not taking information the way that we should be, that can and will lead to errors. So don't just focus on the technical aspect of people's workplace and jobs. Also focus and give them help and coaching in these non-technical skills that people just tend to assume that are easy and common sense. Get these two working together, technical and non-technical, and you will improve safe and effective performance.
Thanks for that, panel. It's been a really invaluable input, and I think we've looked at a lot of different topics from different dimensions, different motivators, and I think it's really important, particularly for the audience members, that if they do have these issues, they do look for that type of support. In terms of any other issues, any other points, anything that we've not covered, anybody would like to add anything to share with the audience today? Or we've pretty much burnt out for our input. It's been a very intense hour. We've covered a lot of emotive issues, and again, not just the technical. I'm really pleased with some of the points and some of the slants that different people's experiences and perspectives have been able to share. You know, the importance. I think the important thing is that yes, recognise we're not the same level of performance, and we're not going to be for some time for different reasons. Whether or not that's because of the psychological, the welfare, the mental well-being, or the fact, as you said, sometimes not necessarily having the infrastructure, the systems and processes which need to be developed. So the importance of developing these good, robust new procedures. I think, again, the big one I really like, which Scotland has been pushing and has been pushing in particular, is the communication side of things, this openness, transparency, you know, building this trust in order to build sort of personal resilience as well as organisational resilience. So I think going forward, we're in this together, and obviously the support, whether it's you as an individual at home or you within the business, that support is key, whether it's in terms of the soft skills, whether in terms of systems and processes, or whether it's in terms of robust IT systems and technologies to support and protect the business and our own welfare and well-being as we go forward. There's been some really good issues covered. Really thanks to Carla for joining us from afar at this ungodly hour, knowing full well that, you know, as remote gets, you are remote, but we're still we're going to still keep you involved, and thank you for invaluable input. I love talking to you because you're always enthused. You always put things from a different perspective, which I think is really important at this time, that we look to try and motivate others, seeing these things as opportunities.
Because I'm upside down, Hugh. It's because I'm in Australia. I'm coming at you from the other angle.
That's what it is. I'll tell you what, my wife thinks I've been that way for years, so don't worry. She knows there's something amiss with me. But no, it's great. It's great it's always great to have people who are passionate, and that's the one good thing about this panel today. You're all coming from different disciplines with great experience in your own areas around the world and in your different businesses. And, you know, having this opportunity to share this with our audience, we can learn so much from each other and share so much. And sometimes, as you said, it's just having somebody to talk to when you need them. One of the big things I've found difficult has been the isolation. Although I'm at home with a wife, my son's been working, he's furloughed for a while. It's not the same as being out there day to day, dealing with the same people, dealing with different customers. And it puts you under different pressures in yourself and your own, you know, you question yourself sometimes. So I've got my own coping strategies, which I've had to develop, which I suppose all of you had. You know, it's not been easy at all. So, any questions, Claire? Do you have any questions from the audience out there to share with us?
We don't have any further questions coming, Hugh, so it's probably just time for some closing thoughts.
Okay, then, if we start ladies first. Helen, closing thoughts?
Closing thoughts, embrace the changes that we're seeing. There is, whilst we've spoken a little bit about some of the negativity around, there is absolutely a huge amount of opportunity, so don't be frightened to embrace that.
Fantastic. Carla?
Absolutely. Embrace those opportunities, but also be sensitive to people who might be suffering at the moment, and realize that your frustrations with others might be because of another reason. Think of that two stories thing. Think of someone else's perspective as well.
Very good point there, Carla. I nearly let off steam with my wife yesterday, and it was nothing to do with the fact, it was just the fact she was in the firing line at the wrong time. I managed to count to 20 because I've been with her 30 years. I'm getting to like it. Sam, let's go for your input, please.
Yeah, I would just say, remember, we're all a team. We're all here for each other. We've all got different skills. We're a massive organisation, and, you know, within that organisation, somebody may be able to provide support for you, and the importance of networking.
And could I'll just ask Claire, Claire, have you got anything to input with us? You know, you've been able to listen to all of our views. Anything you'd like to add before I ask the gentleman to close us out?
No, thank you for the opportunity though, Hugh.
Good stuff. I think this has been really worthwhile exercise. Andy, can I have your thoughts, please?
Yeah, I just think that the industry it's been remarkable how it's adapted to a huge influx, and that adaptation, and I would just say remain open and listen to the workforce and be flexible within those parameters, but keep everybody safe. That's the only thing. I think it's remarkable how we've adapted to that. And I wish I had shares in Zoom, really. Things like that.
So true. Thank you so much. And Scott, back to you again, sir. You started, so I'll leave you for the closing thoughts. Thank you so much.
No pressure.
No pressure ever, mate. No money or caliber.
Just in the last hour, I've taken on a lot of what everybody's saying, and I think that there's a lot of information there, but just take small bits on board and just try and implement little bits at a time. Don't try and implement everything at once. And I'm certainly, just by listening to this last hour, there's certain things that I can implement in our business, and that's what I'm going to do, nice small steps. But it's been really useful for me. Thank you very much.
Thank you everybody for your participation. I think that's a really good closing point. Baby steps, focus on where your priorities are, and try and share lessons learned from elsewhere. I think that's so key. Thank you everybody. It's been a real pleasure to really share your thoughts. I've got a copious amount of notes here, and I'm meant to be the one who's actually organising your guys' input. So I've got a lot of learning to do as well. Thank you so much. Audience, thank you. Claire, Susan, Holly, all of the audience, go out there, stay safe, stay well, and please join us for our next one next month.